Hi, I'm Ana Garcia, and I'm at the Dr. Falk Lab. I'm a sophomore in high school. I go to Nogales High School, and the two topics that we focus on in our lab are Parkinson's disease and levodopa-induced dyskinesia, which are both neurodegenerative diseases. And our lab's main question would be, how can we cure and treat levodopa-induced dyskinesia? So I have different mentors this summer, them being PhD graduate students, being Ravina, Kelsey, and Carolyn, and I'm going to walk you through a little bit of our lab. So here we have some IHC slides that I worked with my lab partner. There's a lot of attempts at them, along with there being a lot of failures as well. Here I learned how to pipette for the first time, and we also have to learn how to make our own solutions, which is just a little part of what we did this summer. So the reason our lab focuses on this research is to give patients with Parkinson's disease a better quality of life. And some of the research that goes on in this lab is both animal behavior research and molecular research, which is both to study the inside of the brain as well as what goes on the outside. And I had the opportunity to do both immunohistochemistry and Western blotting, which contributed to this research because we were able to identify if the lesions, RADs, and the behavioral analysis were actually correct. So specifically the Western blots were successful. We actually had lesion the right side of the brain, which was shown in our Western blot results that the right side of the brain had less tyrosine hydroxylase and the left side was almost intact, which showed that our results were successful. And to finish off the video, I also wanted to talk about some of the questions I had at the beginning of the lab. So my questions were very simple since I didn't know many of the lab techniques. The main questions I had were, how do the antibodies attach to the proteins? How can I pipette correctly and follow all the lab protocols? And what are Western blots and IHC?